Welcome to the press briefing. With us today are Dr. Albert Au, Principal Medical and Health Officer of the Center for Health Protection, and Dr. Lau Ka-hin, Chief Manager of the Hospital Authority. Dr. Au will first brief us on the cases. Good afternoon. I would now report the latest information on COVID cases from March the 14th at the CHP. Yesterday, there were 11,556 cases who tested positive through PCR tests. Case number 635682 to 647637. Of these cases, 2,005 cases were detected through the Hospital Authority, 2,137 were detected through the Public Health Laboratory. The remaining 7,814 were detected through private laboratories. 4 cases were imported. The remaining 11,952 cases were local cases. In terms of genome sequencing, the Public Health Laboratory analyzed 2,137 cases. No L452R strain was found, and 418 samples tested negative to the strain, and these were Omicron cases. 1,719 cases were pending, or the viral load was too low. In terms of the rapid antigen tests, yesterday, 15,809 cases were verified as positive cases. On March the 14th, as of March the 14th, altogether there were 27,765 cases, including 11.556 thousand from PCR tests and 15.809 thousand from RATs. In the fifth wave of the epidemic, altogether there were 748,919 cases. In terms of the cases at care homes, yesterday, there were new cases or outbreaks at 6 new residential homes, including 5 RCHEs and 1 RCHD, including 43 cases involving 30 residents and 13 staff members. Altogether, in the fifth wave of the epidemic, 757 residential care homes were affected, of which 313 saw new cases or outbreaks in the recent 2 weeks, making up 39% of all residential care homes. In the fifth wave of the epidemic, altogether, 29,176 residents were infected, making up 39% of all residents at care homes. Another 7,290 staff members were infected, or 24.5% of the total number of staff members. For RCHDs, altogether, 271 RCHDs saw cases or outbreaks in the last 2 weeks. 133 cases arose from RCHDs, making up 40% of the total. And in this wave of the epidemic, 7,680 residents from RCHDs were infected, making up 42% of all residents. Another 2,725 staff members were infected, making up 26% of the total number of staff members. For death cases involving residents, the number rose to 2,526. In terms of the latest death figures, in the fifth wave of the epidemic, Hong Kong saw 4,355 deaths, of which 294 deaths arose from yesterday. The overall mortality rate rose by 0.58%, and of the deaths, there were 2,680 males and 1,675 females, aged 11 months to 112 years old. The median age was 85. 5 children were involved. For adults aged 18 to 59, there were 188, making up 4.3% of all deaths. For elderly people above the age of 60, there were 4,155 deaths, making up 95% of all deaths. For elderly people above the age of 80, there were 3,058 deaths, making up 70% of all deaths. For the new cases yesterday, 5 were reported by the Department of Health mortuaries, 5 were found dead at home. All of them were males aged 57 to 81 years old. Their dates of death were from February the 27th to March the 1st. 4 cases had chronic illnesses. In terms of the analysis of samples, the public health laboratories carried out genome sequencing on 198 samples. 21 samples tested positive towards the L452R. That is, they were Omicron cases. They made up 10.6% of the total. 167 samples tested negative to L452R, and they made up 84% of the total. For the remaining 10 samples, the viral load was too low. In terms of vaccination, among all deaths, 89% were unvaccinated or only received 1 dose. For those aged above 80, 91% of the deaths were unvaccinated or only received 1 dose. Among all cases of deaths, for those who were unvaccinated or only received 1 shot, the mortality rate was 1.86%. For those who received 2 doses, the death rate was 0.09%, and the difference was 20 times. For elderly people above the age of 80, for those who were unvaccinated or only received 1 dose, the mortality rate was 12.1%. For elderly people who received 2 doses, mortality was 3.2%. The difference was 4 times. Dr. Lau will now brief us on the situation at the hospital authority. Good afternoon. Currently, 10,228 confirmed patients are staying in public hospitals. The North Lantau Hospital Infection Control Center, the HA Infection Control Center, and the Asia World Expo Community Treatment Facility. Last night, 62 patients were in critical condition. 145 patients were in serious condition. 111 patients in critical condition were staying in ICUs as of midnight. Over the past 24 hours, 228 patients who tested positive to COVID-19 passed away, including 131 males and 97 females. They were aged 19 to 107. And I'd like to offer an analysis of the 228 deaths.
Among the 228 patients, 123 resided in care homes, 53% of them. Among the 228 patients, 165 were unvaccinated. And there were 36 patients who had received 1 dose, 27 received 2 doses, and 2 patients received 3 doses. For deceased patients above the age of 65, and there were 208. Now, I would like to give you some information about the patients who passed away. There was a 19-year-old patient. The patient had chronic leukemia, and the medication was not effective. So the patient was a patient with chronic disease in poor health. Another disease, that patient was 40 years old. The patient had heart issues and thyroid, and also the patient was mentally incapacitated and resided at a care home. Now, the third patient, a 43-year-old patient with immunology issues. The patient had type C hepatitis, tuberculosis, and brain tumor. The fourth patient was a 47-year-old patient. The patient had heart problem, and also respiratory issues with chronic diseases like diabetes and hypertension. The fifth patient was a 48-year-old patient. The patient had mild mental, moderate mental incapacity. He had type B hepatitis and had epilepsy. The sixth deceased patient was a 49-year-old patient with a genetic disease. The patient had blood vessels issues in the brain, and also epilepsy, also residing in a care home. The fifth patient was a 31-year-old patient with diabetes and with a late-stage renal failure. The patient was also in poor health. The eighth deceased patient was a 55-year-old patient. The patient had hypertension and had a stroke. The patient was not able to eat on his or her own and was residing in a care home. The last deceased patient was a 57-year-old patient with inborn blood vessel issues. The patient had fingers removed. The patient had strokes and heart diseases, and also the patient required stomach dialysis because of late-stage renal failure. So all these patients were patients with chronic illnesses. Some of them required care and were staying at care homes. And because of the backlog, today we have to report some death cases between the 8th of March and the 13th of March. There were 56 patients who passed away, including 37 males and 19 females aged between 26 and 101 years. Now, about the 26-year-old patient, the patient was a patient with severe mental disability residing in medical institutions. The patient had inborn kidney problem as well as epilepsy. The patient required long-term care and was staying in hospitals on a regular basis. In the past 24 hours, 905 patients were discharged, and around 35 patients were found to be positive on admission and screening, and 45 patients in the same ward were classified as close contacts. So far, 15,766 medical staff members were confirmed. Among them, 7,597 have recovered and returned to their positions. And I have two reports to make. First, the commissioning of the isolation and monitoring system. The system's purpose is to provide support to patients at home. The system will commence operation at 6 p.m. today. Confirmed patients will receive an SMS with links. Via the links, patients can submit their personal data, their testing results, as well as their health conditions online. Patients can report their symptoms, including warning signs. For example, continuous high fever for 2 days despite antipyretics, low body temperature that is lower than 37 degrees Celsius, seizures, discomfort in the chest or abdomen, and so on. After making the reports, the system would remind the patients that these are rather serious symptoms, and the patient should approach an ANED or approach a clinic. If high risk factors are declared, for example, below the age of 5 or above the age of 70, pregnant women over 28 weeks pregnant, transplant patients, then the system will remind the patients to make a booking as designated clinics. Also, colleagues working as the patient support call center would follow up on these high-risk patients. The report would also, the system would also provide information and recommendations to patients, and also RAT test results can be submitted via the platform. However, I would like to remind the public that the platform is targeted for patients staying in isolation facility centers. So please save the system for the one in need. Now about the Mainland medical teams. Starting this morning, the Mainland medical team has visited the Asia World Expo Community Treatment Center to get familiarized with the system and the venue. They will start working tomorrow. And also the HA has sent a team to help the Mainland colleagues, including briefing them on the procedures, clinical systems usage, prescription of medication, medical treatments, procedures, and other operational details. To facilitate the medical team, we have added Chinese interface into the clinical record system and other systems. The HA will deploy a team to offer support to the Mainland colleagues, so that when they are providing treatments for patients, they can have access to clinical information via the systems. And also, when necessary, our team would help the Mainland teams to communicate with patients. The Mainland teams would be providing assistance at our facilities under the name of the HA, and we thank the Mainland Medical Support Team for the help, and it is very effective in alleviating the burden faced by the HA. Now about the operational situation of the AWE Community Treatment Center. You may recall that during the first few waves, the AWE facility took in patients who had mild symptoms and who were relatively younger. In the fifth wave, we have a lot of patients need to be put into hospitals, and also we have a lot of elderly patients requiring treatment. The community treatment center is also taking in patients who are in an elderly age with chronic illnesses and required more help. Because of the constraints of the AWE, and also we want to focus our manpower on offering care for patients with serious conditions. As a result, we cannot provide bathing or showering services for bedridden patients. We understand that this is not satisfactory. However, please understand our situation, and we will do our best to care for the patients. Our staff would assess the situation of the patients and help turn the patients, change diapers, and clean their bodies. And also, we will also assess the skin conditions of the patients. Depending on the needs, we would wipe and clean the patients' bodies on the bed.
With the support offered by the Mainland medical team, the standard of care provided for the patients would further improve. We would review our workflows and scope of service on a regular basis to improve our operations. With the extra manpower, including doctors, nurses, and other healthcare staff, we will be able to receive more patients at our community treatment facilities. The floor is now open for questions. Please identify your organization before you speak. The lady on the front row, please. I'm from Phoenix TV. We realized that the SAR government requested support from the mainland team. The first team of about 70 has arrived in Hong Kong, and they have familiarized themselves with their surroundings at Asia World Expo. And there were calls that since there was a lack of registration among these medical staff from the mainland, if there are issues, how would they be dealt with? So in terms of the language for communication, etc., could the arrangements be clarified that way? We can know more about the professional background and capabilities of the mainland medical support team. Since the fifth wave started, we have received more and more patients, and this has far exceeded our capacity. And that is why we have received support in terms of hardware and software from the central government, and many new facilities were built. Yesterday, the mainland medical support team arrived in Hong Kong to render assistance. The first batch of staff came from Guangdong province, and many of them spoke Cantonese. If they have issues communicating with patients, our staff are very happy to offer help, say, by providing translation. Hong Kong uses English as the predominant language, and that is why we have sought to improve our systems. By introducing Chinese interfaces and information in Chinese, that way the support team could understand the operation at Asia World Expo. We understand that the support team members who arrived in Hong Kong were all elite professionals, and they had some important information and experience to share with us in terms of how we can treat and care for the patients, reduce mortality, and support their recovery. For mainland medical support team members who arrived in Hong Kong, they would be considered honorary members. So anything that happens at Asia World Expo and on the patients, the ultimate responsibility would lie with the hospital authority. Next question, please. Good afternoon, I'm from Now TV. I'd like to follow up on the mainland medical support team. They arrived at Asia World Expo today to understand the operation of the facility. So when would they actually begin work? So what is the division of work between them and the medical staff in Hong Kong? Can the mainland support team offer independent clinical treatment, or would they need approval from the Hong Kong staff members, despite the fact that the HA would assume final responsibility? But if in case of any healthcare or medical incidents, would there be any consequences for the remaining 300 members? When will they arrive in Hong Kong, and which community treatment facility would they be responsible for? Yesterday was the last day in which members of the public could report their positive results from the 26th of February to 7th of March. We saw about 10,000 new cases, the majority of which were tested positive through RATs. Were these numbers in line with your expectation? And could such reports help you have a better grasp of the situation? You said among the 5 males, 4 had chronic illnesses, 4 passed away at home, and the other did not have chronic illnesses. Can you offer more details for oral drugs for the HA's designated clinics and residential care homes? What is the current stock of oral drugs? Is there an ample supply, and how much would be lent to private hospitals? I'd like to first talk about the Mainland Medical Support Team. We engage in collaboration with the Mainland Medical Support Team. If you have been to hospitals, you would realize that patients are cared for not by an individual, but by our team, involving doctors from different levels, and different staff had their respective expertise and proficiencies. We have local experts, and Mainland experts would also offer their professional advice. So we would engage in joint care for the benefit of the patients. Like I said yesterday, we would work together to come up with a treatment plan for the patients. And in terms of the issue of responsibility, honorary employees are actually not a novel concept. Many professors are our honorary employees. In other words, they were not hired by ourselves, but they can serve as honorary employees for us by providing treatment and administering drugs on the patients. And we hope to make use of their expertise to help treat our patients. The terms or provisions that apply to our employees on patients would equally apply to honorary employees. Despite the fact that they are honorary employees, they are considered the same as the HA's employees, and they would assume ultimate responsibility on the treatment offered to patients. Today, the support team familiarized themselves with the operation of the facilities, and within days, they would start attending to patients. And later this week, another 300 members from the Mainland Medical Support Team will arrive in Hong Kong to help take care of our patients.
So, on oral medication, previously we received the MSD's delivery. Yesterday we received delivery from Pfizer. In the near future, we will prescribe the medication to patients which fits the indication and conditions. Some patients are not fully vaccinated. Some patients are of an advanced age with weakened immunology. These are the patients who will require these medication. And also there are some contraindications as well. Now we will prescribe the medication in hospitals, designated clinics, and the RCHEs. And also we have shared the guidelines about the suitable clinical conditions for prescription with our experts. Your second question was about the RAT online platform. We previously announced that for patients tested positive through RAT between the 26th of February and the 5th of March, they could register the test results online before the 14th of March. The period has expired yesterday. Those who have made an registration would receive a SMS. Many patients have submitted their personal details via the SMS links. Some are yet to do so. We believe that later today, the patients will submit their personal information for us to confirm. So after midnight tonight, we will be able to get an actual picture concerning the daily number of RAT positive patients between the 26th of February and the 5th of March. We will announce the figure tomorrow. And about the RAT online registration platform, it really facilitated our analysis and tracing efforts. In the past few days, the daily number of RAT positive cases hovered around 10,000 each day. So every day, we would combine the positive number between the numbers of RAT and PCR tests. We are seeing an increasing ratio from the RAT test. Today, the proportion of RAT positive tests exceeded PCR tests. So it would help us gauge the actual scenario in Hong Kong. If we just look at the PCR positive numbers, it would give us the false perception that the number has been dropping in the past week. But if you also look at the RAT test, in fact, every day our numbers still hover at 30,000 cases per day. So the platform is really a great help. Now, when patients are tested positive, it takes shorter for us to be informed. Previously, we need to confirm the test, and there would be delays. So the patients would not know that they are positive after in 3 or 4 days. Now, with the RAT system, we can quickly be informed about the patient's conditions and provide help. Now, finally, I would like to clarify a figure. Now, the total number of cases in the 5th wave is, the number of death cases is 4,355 cases, 289 cases more than yesterday, including 5 cases from the backlog. Now, there was a 57-year-old male deceased patient living in Kwai Chung. He was found dead on the 28th of February. According to initial investigation, he had no chronic disease, and he had symptoms, and he fainted at home. And when the ambulance arrived, he was pronounced dead at home. Next question, the lady in the middle. Hi, I'm from Cable News. And previously, the HA said that patients at designated clinics would be prescribed the oral medication. However, according to the patients, some immunocompromised patients claim that they were not prescribed the oral medication. They were only prescribed with cough syrups. Now, some clinics refuse to treat COVID patients. Some even put surcharges on patients with symptoms. So would the HA issue guidelines to clinics? And also at the clinics only have the traditional conventional medication. So would you also give them a new drugs? Now some patients after 14 days they recovered and they were allowed to go. But what about household members confirmed positive? Do they need to start the quarantine again? It seems that there is no clear guidelines. Now, the two oral medication, including the MSD's molnupiravir, and also the drug from Pfizer. We have clinical guidelines for our staff to prescribe the medications, including the vaccination record, the age, for example, whether they are above the age of 70 or below 5, whether the patient is pregnant or whether the patient is immunocompromised. It is not about how the patients feel. There are objective guidelines, for example, whether the patient had organ transplant or whether the patient has immune disease or whether the patient is taking immune suppressants, for example, cancer drugs. So we will assess the symptoms and the bodily conditions of the patients and follow the clinical guidelines in prescribing the two new oral medications. So if you are seeking medical advice at a designated clinics, and if you have any doubts, you can ask the doctor whether you need to take those new medications so as to clear doubts. The second question was about household members of recovered patients who are tested positive. Does the patient need to undergo quarantine again? Normally, during the initial period after recovery, the recovered patients would be protected against the virus. It is not likely that the patients would be infected again in a short period of time, for example, 10 days, unless there is a new variant. However, the major variant is Omicron in Hong Kong. Now, if a patient is not vaccinated, the isolation period would be 14 days. On the 14th day, if the RAT is negative, then the patient can go. Now, the household members would be subject to quarantine as well. If they test positive subsequently, then for the recovered patient, no further quarantine order would be issued to him again. The case may be that household members test positive subsequently. Then the quarantine period for unaffected household members will start counting from the day when the last sample was taken.
Next question, please. The speaker is not coming through the microphone. The speaker is not coming through the microphone. The lady at the back, please. I'm from commercial radio. Despite the extra designated clinics, it's still rather difficult to make a booking. Some experts said that the oral medications should be administered as soon as possible, but some elderly people are concerned that by the time they receive the drugs, they have exhibited symptoms for more than 5 days. So how could you prevent cases in which patients' conditions worsen as a result? And paracetamol has been added to the kits to be distributed to positive patients, but there are lack of guidelines on the use of or the combined use of Chinese and Western medicine. Would more guidelines be added for the isolation care system? Once activated, how many cases are expected to be dealt with by the system every day, and how and what would you do with the reported cases? When a patient, if a patient is to visit a designated clinic, they must first make a telephone booking. And with the care hotline we introduced recently, it's now easier to make a booking. The hotline is provided for elderly people, those who are young, pregnant for more than 28 weeks, or immunocompromised patients. So we are currently providing priority to these patients so that they can seek medical attention earlier, and if needed, we would prescribe medicine. For the two oral medications, like you said, they should be administered early on, that is 5 days within the onset of symptoms. And these are suitable for people who are not fully vaccinated. They must be at least 70 years old, or individuals who have high risk factors, such as immunocompromised individuals, those who are on cancer drugs, those who had received organ transplants, etc. But of course, it would depend on their symptoms. If they do not experience any discomfort, the drugs would not be needed. We will look at the blood oxygen levels, etc., and we would assess whether they have developed pneumonia already. So all these require clinical assessment by doctors before a decision is made. The criteria I just mentioned would fit the bill for high-risk patients. If we can assign at least half the lots to these patients, and by providing a hotline, we believe they can secure medical attention on time and receive medication. The new system seeks to support confirmed patients in the community, or patients who were arranged into community isolation facilities. After receiving an SMS, they can log in online and fill in their personal particulars. For instance, whether they carry any high-risk factors, their health conditions, etc. That way, we can provide more information for them. But in any case, we would provide basic information on maintaining hygiene, how they could isolate, and they would have to produce RIT results on days 6 and 7, and they can report whether their results are positive or negative. For patients that exhibit warning signs, for instance, those who develop high fever for 2 straight days, those who have chest pain, etc., we would remind them to pay attention to such symptoms, and they are reminded to seek medical attention. They can go to an A&E ward or inform staff members at the community isolation facilities. For those who carry high-risk factors, such as those above the age of 70, under 5, or pregnant for more than 28 weeks, they would receive calls from our patient support call center staff. For those who show mild symptoms, they would be reminded to seek they can call the care booking line. I don't have the numbers on hand since the system only started operation at 6 p.m. Well, it will start operation at 6 p.m. For patients who were admitted to hospital, they would not need to report any information to the system since they are attended to already, and they do not need to report their symptoms. For those who if you are infected, then it's always better to receive more information. That is why we introduce a hotline. And we would also provide information on the designated clinic hotlines, etc. So at this point, we hope to provide more attention and care for these patients. Dr. Ao, anything to add about the information kits? In terms of the information kit for home isolation, once we receive a confirmed case report, their information would be referred to the right departments, and information kits and anti-epidemic kits would be distributed as soon as possible. The lady on the second to last row, please. I'm from Ming Pao. First of all, a question for Dr. Ao. For the 5 cases from mortuaries, did the patient seek medical attention, try to book appointments at designated clinics, or call the ambulance? According to projections from HAU, by the 14th of March, 3.58 million people were infected. Were these in line with government projections? From 28th to February to the 5th of March, did the RET positive numbers tally with such projections? If there's a big gap, does it mean that many people did not receive their diagnosis? For the deadline for submitting RET positive results was March the 14th. How many people did not upload the required documents after the 15th of March? The CHP told residential care homes earlier that the number of staff members who tested positive did not need to be reported to the CHP anymore. What was the reason for that? And if that's the case, where did you obtain your figures on the number of confirmed cases among staff? You said 62 patients were in critical condition and 111 were in serious condition. Can you clarify these numbers? There were more patients in ICUs than the number of patients in critical condition. Can you explain that? For the care hotline and ordinary hotline, what is the average number of days needed to secure a booking? And would it take more than 5 days, which is the golden window for treatment? How do residential care homes ensure that the patients who test positive could receive drugs within 3 days? And some Hong Kong doctors said that the mainland medical staff issued certain Chinese documents, and they had to be rewritten in English by Hong Kong medical staff. Would that affect efficiency?
Now you mentioned the mathematical model adopted by the University of Hong Kong. They adopted some parameters to project the infection number in the near future. Now, as we all know, the Omicron variant is highly infectious. There may be it may be airborne. And also, a characteristic of Omicron is many of its patients are asymptomatic. So we know for a fact that the infection number does not reflect the real picture. There are many people who have no or mild symptoms and they are not tested. So we will never be able to find out these cases. All along, we are looking at the trend. We would look at the PCR test results and look at the trend. So far, we have some 700,000 cases. According to local mathematical models and foreign medical journals, for every known case, there may be 3 to 4 unknown cases. So the projection made by the University of Hong Kong is reasonable. Now about the RAT online registration platform for reporting past cases. The deadline was yesterday. The SMS is valid for 24 hours only. So for a small number of patients before midnight yesterday, they still haven't uploaded their information. So the SMS link will expire by midnight tonight. So after these patients have uploaded their information, we would collate the figure. According to the past week's experience, most of the patients who received our SMS would upload their personal information for us to confirm, and then we would include them in the daily number. The third question was about the reporting criteria for staff at care homes. Many staff members are making use of RAT. So our requirement is that if a staff member is tested positive through RAT, then just like ordinary members of the public, they have to report the case via the online platform, and then we would issue the isolation order to them and quarantine orders to their family. Second, if a care home is aware that one of its staff is infected, they need to report to us. When there are additional cases from care homes with known outbreaks, they still have to report to us promptly. That has always been the guideline we give care homes. Concerning the figures we announced, last night we reported an additional 62 patients in critical condition, and 145 patients were in serious condition. So the total number of critical patients, 111 are in ICU. I don't have the figure. On the 13th, I need to check before I give you an answer. Now the announcement is on the additional number. That is, we had 62 additional patients in critical condition and 145 additional patients in serious condition. So the latest figure is only until the 13th. At the time, there were some 600 critical patients. I'm not sure yet because it is not very, the figure is not very tidy. I need to check before I answer you. And then about the care hotline. Yesterday, the additional designated clinics were not commenced yet. We had 3,000 tickets yesterday, and today we have some 4,000. So yesterday, designated clinics received some 3,000 patients. So the idea is to give a priority tokens to patients in need. So if their symptoms meets the prescription criteria, they could be given the medication. So we hope medication could reach them in 5 days after infection or after symptoms, after onset. So the criteria is old age or immunocompromised people at a younger age. These patients can reach us quickly and get a priority token through the care hotline. So for care homes, the situation is easier to deal with because we have outreach gynecologists to offer help at care homes. For patients in care homes, they are not very mobile. It is not convenient to take them to see a doctor. So we have this service for quite some time already. Doctors are working in outreach teams, are working very hard to care for patients in care homes. If they are unvaccinated, if they are of an advanced age, or if their blood oxygen level is low, then they would be prescribed with medication to prevent serious symptoms. Now about the Mainland medical support team. We have our own clinical system. The Mainland experts would be given access to the system. As far as I know, many members of the medical support team from the Mainland can read English. For operational efficiency, we have also added a Chinese interface for them to use. And also we would provide a translation and other support to them. For example, there are some terminologies specific in the Hong Kong context. We will make sure that they can understand them. The idea is to work together in a united manner to offer the best care. Next question. Hi, I'm from Ta Kung Bao. Concerning the high number of infections in the community, the government is still adopting RTD and implement small district restriction and lockdown in a short period of time. So is that still effective? For every restriction and testing declaration, you would have to deploy 140 to 150 people. So do you think it is a reasonable use of your manpower resources? Now about the RTD operations. Through sewage sample testing, if infection is found in a building or a district, RTD will be carried out. Every night, there are at least 10 buildings subject to RTD, and through the lockdown, many cases are found. It shows that it is an effective measure to find out invisible and undetected cases in the community, so that we can arrange patients to go into isolation facilities and avoid community infection. In terms of manpower, the government has mobilized manpower from most of our departments, as well as additional forces in the civil service, like the Secretary for CSB, for Civil Service has said.
I'd like to report the results of the recent RTDs over the past week. On average, For positive cases detected through RTDs, the percentage was between 12 to 13%. More than 15,000 cases were detected through these restriction testing declarations in the recent weeks, starting from March the 10th. The number of people tested were about 28,000, and we found 3,400 cases, or a percentage of about 12%. And where appropriate, these patients were transferred to community isolation facilities, and their household members would be put on home quarantine. The final question for the lady on the back row.
So can we have the details of the child under 3 years old who is living in the ICU at the moment? And second, did the 13 private hospital pledge to reserve a total of 1,000 beds, mostly for non-COVID patients, helps to ease the pressure on the healthcare system? And third, Dr. Lau, could you please repeat the death number and vaccination status of the fatalities in the past 24 hours, because you said 228 passed away in the past 24 hours, but the vaccination status did not add up. And lastly, there have been 852 imported cases in the fifth wave. Have any of them been serious, critical, or patients who passed away? Thank you.
Okay. Up to this moment, I don't have the information of the child who are 3 years old who are in the ICU, because there's no. The youngest critical case is sorry. Sorry, I don't have this information. Sorry.
For the last question on the imported cases, among those recorded in the fifth wave, we do not record any death among the imported cases.
Yeah. Yes, because of the shortage of the manpower in the hospital authority, we are happy that the private hospitals has provided many beds for our patients, including the patients after the operation, for the patient for the rehabilitation or for the convalescence. At the same time, they also agree to take up the patients for the surgery, as well as those patients for the heart disease. Besides the non-COVID patient, there are some hospitals, including for example, the Chinese University Medical Center. The center has agreed to take up some relatively stable COVID patient. So this is a very good news to hospital authority, and as well as to the Hong Kong, because after the stable patients or after the non-COVID patients are transferred to the private hospital for treatment, we have more beds and more capacity to treat our COVID patient. At the same time, besides COVID patient, we still have some non-COVID patient in our hospital, and they may not be able to be transferred to the private hospital, or they may not be able to be cared in the private hospital. So in the hospital authority, our doctors are treating the COVID patient as well as the non-COVID patient, especially those in the critical stage, we need some emergency treatment in our hospital authority.
今日記者會完結，多謝大家。
This is the end of the press briefing. Thank you.
Sorry， 我頭先講漏咗一個咧，係
I'd like to provide some information on vaccination. 163 were unvaccinated, of which 36 received 1 dose, 27 received 2 doses, and 2 received 3 doses.
多謝大家。
Thank you.